Hello everyone, welcome. Today our topic is Westgard rules. James Westgard is a founder of Westgard rules. It is widely used in clinical laboratories and healthcare industries to check machine and test performances. They have all information regarding quality control on their website known as Westgard QC. For quality procedure, quality control material is required. For example, if you are performing a blood glucose level on the chemistry analyzer, you will need a reagent, calibrator or a standard and a quality control to perform test and release the result of the test. You tested a sample for blood glucose level of a patient and result came out to be 105 mg per dl. But how will you make sure that this result is correct and nearly accurate for that particular patient? For this, we need a quality control procedure for each test. Let's understand the concept of accuracy and precision first. Accuracy refers to degree of closeness of measurement to the analyte's true value, and precision refers to closeness of two or more measurement to each other. In this picture, we can see four target rings. First target ring on the left side upper corner shows low accuracy and low precision. Data points which are plotted on the target are dispersed and away from each other. Second target ring on the right side upper corner shows low accuracy and high precision. Data points which are plotted on the target are concentrated on one point, but that point is far away from the center. Third target ring on the left side lower corner shows high accuracy and low precision. Data points are scattered around the center of the target. Fourth target ring on the right side lower corner shows high accuracy and high precision. Data points are concentrated on the center of the target. When we run the test, we expect that our result to be accurate and precise every time. Quality control material is known concentration of matrix similar to the patient sample. QC material has a particular range of results that are predetermined. If you run that material in optimal condition in particular machine or with reagent, then result should come within that defined range only. Let's see an example of QC material level in reference to blood glucose test. It can be of three levels. Low level, where the range is between 45 mg per dl to 55 mg per dl. Normal level, where the range is between 90 mg per dl to 100 mg per dl. And of high level control, where the range is 300 mg per dl to 330 mg per dl. If you run the low level QC, result should come in between the predefined value, that is between 45 mg per dl to 55 mg per dl. According to your workload, you should perform QC once daily, twice daily or thrice daily. If any deviation occur in that situation, you will need a Westgard rules. Data must be reviewed for deviation and proper correction and preventive action. This reviewing procedure is called the Westgard rules. To understand Westgard rules, we need to understand the concept of normal distribution and standard deviation. If you have set of numbers or observations, you can plot data where the mean is in the center of the graph. Mean and ST can be calculated from the data set. In normal distribution, 99.7% of data will fall under 3ST, 95.5% of data fall under 2ST, and 68.3% of data fall under 1ST. We can conclude that if our observation fall under 2SD range, then the result is acceptable. In QC chart, mean 1SD, 2SD, 3SD are plotted. SD is derived after the 20 QC data run, or we can use SD given by the manufacturer. Here level 1 QC mean is 50 mg per dl, First run QC result is 52 mg per dl, second run QC result is 56 mg per dl, and so on. So we have to plot our QC result accordingly. Let's dive into the rules. Multi-rule QC uses combination of decision criteria or control rules to decide whether an analytical run is in control or out of control. First, we observe the control data. If it is within 1 2s, then everything is fine except that run. If control data is outside 1 2s, then check if data is outside 1 3s or not. If 1 3s rule is rejected, then reject the run. Other rules are 2 2s, R4s, 4 1s, 10x. All are rejection rules. If data fall under this definition of rules, then reject the run and do root cause analysis. Let's understand rules. 1 3s rule violation. Run is rejected when the single control measurement exceeds mean plus 3 or minus 3 st. 1 2s rule violation. It is a warning rule. Careful inspection needed for the further QC data pattern. 2 2s rule violation. Reject when two consecutive control measurements exceed the same mean plus 2 SD or minus 2 SD. R4s rule violation. Reject when one control measurement in a group exceeds mean plus 2 and another control exceeds mean minus 2 within same run. 41s rule. Reject when 4 consecutive control measurements exceed the same mean plus 1 or minus 1s. 10x rule violation. Reject when 10 consecutive control measurements fall on the one side of the mean. 8x rule violation and 12x rule violation are the same as that of 10x rule violation. When three different control materials are being analyzed, some other control rules fits better, such as 2 of 3 2s rule violation. Reject when 2 out of 3 control measurements exceed the same mean plus or minus 2s. 3 1s rule violation. Reject when 3 consecutive control measurements exceed the same mean plus 1s or minus 1s. 6x rule violation and 9x rule violation are the same as that of 10x rule violation. 7t rule. Reject when 7 control measurements trend in the same direction, either upward or downward. You can choose a rule according to your QC run protocols and preferences. Usually 1 2s and 1 3s rules are used in clinical laboratories. After rejection of rule, you must perform corrective action and preventive action according to the error present in the system. Error mostly of two types, random error and systemic error. Let's see some example of systemic error. First is problem with QC material. Most commonly encounter error in the clinical laboratory. See when the QC material is dissolved, prepared, and maybe it is altered or faulty or non-acceptable. Second is a problem with reagent. See for the opening date and time of reagent, empty reagent or altered reagent. Third is problem with calibration. Look for expired calibration, wrong calibration fact. Fourth is a problem with machine. Look for machine error and breakdowns. Fifth is other external factors like improper temperature for particular test. Do a root cause analysis of particular error or rejection rule. After that, data should be recorded in the corrective and preventive action document. This is an example of document with details. Reference for this video is Westgard QC website. You can check for more information. Thank you.